Tuberculosis was first recognized in the 1850s and still continues to be prevalent in our society. Grand Forks, North Dakota has seen a recent increase in the disease. Public health experts Don Shields and Raymond Goldstein are part of a team that is fighting the outbreak from spreading. Thanks for coming on the show today.
It's great to be here.
Well, first of all, Don, I want to start with you. What is tuberculosis?
Tuberculosis is an airborne disease, but it's a very fragile disease, and it's something that, although it's airborne, such as flus and colds, you can't get it like that. It's very fragile. It takes close contact over a long period of time to come down with tuberculosis.
Well, how does it transfer then? You say it's airborne but fragile, so what is an instance where?
In order for it to transfer, we have to have very close contact from an infectious person over a long length of time. So we'd have to sit here at the table. It's not something that we can get at a mall, from a glass or a movie or a restaurant. So we'd have to be here singing, talking, in this type of close environment for a long period of time.
Okay. What about diagnosis? How do you diagnose someone with tuberculosis?
Diagnosis is a little more complex because the difficulty with some of the tests and the long lead time to culture out those tests. But basically some of the symptoms of TB is things such as fever and a bloody cough for more than 3 weeks. So those are some of the signs and symptoms you and I would recognize. Doctors then would take like a chest x-ray, CAT scan, do some blood testing, and do some cultures.
Okay. And there has been a recent increase in the Grand Forks community. How many more cases have you seen, and why did this happen?
In October, we identified our first cluster of 3 cases. Since then, we've identified 16 active cases, and we've tested over 900 people who are contacts, close contacts of those 16 cases.
Okay. Raymond, I'd like to ask you now, when does something like this become an epidemic?
The best way to say it is when you have it's contagious and it spreads to it's a population, and it spreads to other areas, and then so you're worried about the ability of it to transmit. And what would you add to that, Don?
I think that's exactly right, and it depends too upon how many cases of tuberculosis you have going on. Grand Forks in North Dakota is a very low incidence state, so we may see 1 or 2 cases a year, but having 16 cases in Grand Forks in a very short period of time makes an epidemic. If we were beyond 2 cases, we generally go into that time. So it's exactly what Dr. Goldstein said, and there's some numbers that go along with that.
Sure. And Raymond, how does public health respond to things like this? I mean, how do you plan to tackle something like this?
Well, surveillance. Keep ready. Expect it. Somehow, for many of us, we forgot this disease. It's kind of like, something of the past, something that our grandparents had, something that won't affect us today. And especially in North Dakota, you don't think of it. You think of it maybe in New York City or urbanized areas, poverty areas. Well, the world's quite different. Yes, you do associate it with poverty, you do associate it with close quarters and problems of poverty, but as you can see in the Grand Forks, it can jump from people with certain risk factors to people who are more affluent, and you would not expect them to have it, but like in a school. So children from all different backgrounds then are exposed to it and are at risk for it. So our job is to have a public health response expecting this, or it could be something else, but expecting this to happen, be ready to respond. This is a classic, which I think Don's going to be too modest about it, but a classic way to deal with public health risk like this.
Sure.
His group mobilized quickly with the partnership of the medical center here and CDC in Atlanta and as well as the state health department were able to work together, bring the tools out there to basically not only detect, but to basically do investigations and then control this type of thing from getting any worse.
So you bring other people in to help out as well.
And this shows a system working.
Sure.
It shows a system mobilizing and working in which we could not do by ourselves.
Right.
And just the classic ways, like before we had all this in place, we were at much greater risk. if we didn't have this team, this excellent team in place, this could have spread much farther.
Sure. Don, how do you protect yourself from TB?
You know, the thing about tuberculosis, it's a very slow growing disease, and so one of the things that you do is you can certainly cover your mouth when you cough and those types of things, but you really have to have a very close exposure from a very infectious person for a long length of time. Our cluster here has really been in a segment that's homeless. There are people that may be staying in a tent in a backyard or with friends. They go in, they don't necessarily have a residence, so they're invited in a home. So the everyday person that goes to the mall or go grocery store shouldn't have to worry about that. But if you've had close contact, we would be calling you and saying, please come in and get tested.
Okay, now this happened, you responded. How do you know, looking at how you responded to this, whether it was successful or not?
Well, the epidemic is still going on. The outbreak is still going on, and I would expect over the next several months to announce additional cases. Whenever you have 16 cases in a community like ours, that you've had so many exposures that we will probably have additional active cases.
Okay, really quickly, Raymond, for you, in terms of public health, how do you know when you've successfully done your job with something like this?
Well, you know that the rate of spreading has gone down. You know that. You know that the people who are have been detected are under treatment. So now you have all the tools in place. You're still doing your surveillance. You don't expect, as was stated, that this is going to go away that quickly, but you know that everything's in place to monitor and see if it stops spreading, or you know, basically things are under control.
Sure.
I think what we learned here is the value of public health.
Yes.
How organized public health can protect your community.
And thank goodness people like you are looking out for others. So thank you so much for coming on the show today and sharing this with us. It's very interesting.
Thank you.
Thank you.